Okay, welcome everyone to another Here to Help webinar. My name is Amber Briggle. I'm the founder, owner, and CEO of Soma Massage Therapy located here in Denton, Texas. We've got two locations. We have franchising opportunities available nationwide. You can find us at mysomamassage.com. I have these webinars on the first Friday of every month. They're meant to help business professionals at every stage, whether you are just spitballing ideas or you've been in business for decades like myself. Try to level up your business, whether it's marketing or setting, KPIs or setting boundaries for your business, whatever it is. We have a whole series of these Here to Help webinars on our YouTube channel at My Soma Massage. Today, we're switching it up because we're recording this in December. We're between Thanksgiving and the winter holidays, and it is a very stressful time for a lot of people. I am a business owner and a franchisor, but I'm really a massage therapist at heart. And so I am here to care for you today. And the purpose of today is I'm going to teach you some self-care techniques that you can use literally while sitting at your desk. I know it's hard for you to get up and walk around the block or get to the gym when you have a deadline coming up at the end of the day and everyone is asking for your attention from all different directions, and you still need to find time to care for yourself. And what's so frustrating is that when you need to care for yourself most of all is often the hardest time to find to make that happen. So today we're going to just go through maybe 20, maybe 30 minutes of just some things that you can do at your desk to care for yourself going forward. So a little bit more about Soma Massage Therapy. Soma is not an acronym. It's not all capital letters. Soma is Greek or Latin for somatic. It means body and feeling. So that's what we're going to be doing today. We're getting back into our bodies. We've been voted best massage center every year since we opened in 2013, I want to say, and best pain management several years in a row. We were selected by the Chamber of Commerce as the top small business of the year last year in 2024. We are open 7 days a week. We have two locations, a main office downtown, which has 7 treatment rooms, and then a satellite location located within the Spinal Decompression and Chiropractic Center. That's just one room, open 4 days a week, but we do have these two locations. We are franchising, and one of the things that really sets us apart is we have like a very different business model. We've got no tipping, which is like unheard of in this industry, but if you've never tipped your physical therapist or chiropractor, there's no need to tip us either. So we have a no tipping policy, full 60-minute sessions. We take HSA and flex. We really personalize every session just for you, and that's just a handful of ways that we set ourselves apart. You can learn more about it if you watch our webinar on your differential advantage, because I talk a lot more in detail, giving specifics about that, about Soma. We are offering franchise opportunities nationwide. I'd love to speak with you. Just go to our website, mysomamassage.com, and click on the button at the top that says franchising opportunities. At the bottom of that page is a little form you can fill out. I think everyone on this call today has actually filled out that form, which is awesome. And there sends you some more information on that. You can hop on a virtual discovery day call. Our next call is happening on December 10th, 2025 at 1 p.m. Central. I'd love to see you there. If this opportunity isn't for you, but you know someone who's just sick of their no good job, or they got fired by Doge or what, I don't know, whatever, like they're just done with it and they want to set up a whole new life for themselves. Send them my way. And if they become a Soma Massage Therapy franchisee because of your introduction, then you'll get either $1,000 cash or a year of free massages, which is pretty dope. So think about who you know. Okay, now into the good stuff. Okay, so these are today's objectives. We are going to bring awareness to your current state of body. There's no judgment. If you're noticing, you're like, ooh, that feels gross. Be gentle with yourself. We're just collecting data because at the end, we're going to see how we feel different, and I bet you will. The second thing we're going to do is I'm going to teach you some ways that you can care for yourself without even leaving your desk. You can do it standing in line at Kroger. You can do it sitting at a red light or in a traffic jam. You can do it right here at your computer, watching this on your phone, wherever you're at. There's ways that you can care for yourself. Gym memberships and yoga mats are great, and sometimes you just don't have time. So that's what today's for. And then the third goal is my third objective is I'd love for you all to find just one small, attainable thing that you can do for yourself every day for like maybe the next week. Don't make it big, just keep it simple, something that you can use to carry yourself through the rest of this week to keep yourself grounded. Okay? Okay, so we're going to begin. I invite you to take a few moments to just really get comfortable. We are going to do some body scanning, some breath scanning. So go ahead and close your eyes, find a comfortable seated position, and just begin to scan your body top to bottom, noticing if you're clenching your jaw, and if so, go ahead and relax that. Drop your tongue away from the roof of your mouth. Notice where your breath is at. If you're able to breathe into your belly and hips, or maybe it's a little bit higher, maybe it's a little constricted. Sometimes often the breath is a really accurate indicator of where you are at in your life today. So for example, if you're having a hard time really fully, deeply inhaling, sometimes that can mean that you are having a hard time taking in what you need for yourself. Sometimes, if it's hard for you to completely exhale, that might indicate that you're having a hard time letting go of something. So just notice that rhythm of your breath. Is it even? Is it uneven? Is it difficult, constricted? Does it flow easily? Noticing where you're holding tension in your body, maybe your neck, your shoulders, your chest, your hips, your belly. And notice also what feels good today. No judgment, just hold on to those feelings. I'm going to check in at the end, but before you open your eyes, a little more body and breath awareness. Gently clench your teeth and bring your tongue to the roof of your mouth, and then scan your body. And now relax. Try that one more time. Gently clench your teeth. Bring your tongue to the roof of your mouth, and then let that go. Notice that difference. And whenever you're ready, you can open your eyes. Come back to this space. And I am curious, especially about the jaw. Is there anyone on this call who would feel comfortable sharing if you noticed a difference when you clenched your teeth and when you let it go? There's no wrong answer, and if you don't feel comfortable sharing, that's okay too. And that's okay. So typically, oh, go ahead, Nisa. What were you going to say?
I mean, for me, I might clench too hard, but for me, it was almost like a closing. And then when you released it, felt like an opening. I mean,
Uh-huh.
it felt like an ease.
Yeah.
That's all.
Yeah. That's very common. No, that's very common. And that's like, what people will notice with when they clench their teeth is that their neck will maybe tense up, right? And then when you relax it, you feel not only your neck release, but often you'll feel your belly and your hips relax too. It's just like a softening everywhere. And so I want you to hold on to that, because when you are stressed, when you're having a hard time sleeping, check in first with your jaw, because I can almost guarantee you're clenching your teeth and letting your jaw relax. As above, so below, right? If you let your jaw relax, everything else should follow with it. Okay. So I'm going to stop the share here because the next slide is about tools that we're going to come to at the end. Okay, so that's good. So we have some body and breath awareness. That's fantastic. We're going to check in at the end, see where you're at. So with that in mind, we are going to now start unlocking the rest of your body. So we're going to start with the jaw. One of the things I like to do at the end of the day when I am washing my face and moisturizing and I'm brushing my teeth, I'm getting ready for bed, is I do a little bit of jaw pin and stretch just to relax this area, because if this is relaxed, everything else is going to relax. So right here is like your TMJ, your temporomandibular joint. And what we're going to do is basically a pin and stretch. So we're going to pin it when it's closed and short. Then when you open it, it's going to create a deeper stretch for that area. So kind of gently pushing on your TMJ on either side. There you go. And then trying to keep your chin as linear as you can. Open your mouth as wide as possible. And then come back to the center slowly. Yep. And do that again. That's good. And you can massage through there. You can even massage your temporalis muscle because this is this huge muscle here when you see like athletes on the sidelines and they're like chewing gum and their heads throbbing. That's their temporalis muscle because it attaches down here onto the TMJ, the temporomandibular joint. So, maybe a little bit of scalp massage, that pin and stretch at the end. And if you notice that your jaw's kind of shifting to one side or the other as you're going up and down, it's probably because you're a little bit tighter on that one side. So you could maybe just massage a little bit longer on that side of your body. But think about doing that maybe at the end of your day before you go to bed, or if you're just stressed out and you're on a Zoom call and you notice you're clenching your teeth, take yourself off camera and then just kind of do that pin and stretch. Okay. The next one is for your suboccipitals. Now, this one is really trippy. Have any of you on this call noticed when you get those tension headaches and they start in the back of your skull and they creep around your head and like lodge behind your eyeballs, right? That it starts back here on your suboccipitals. So first, because again, soma means body and feeling. I just want you to get some body awareness like we did at the beginning, right? So you're going to take your hands and place it at the base of your skull, kind of where your hairline meets your neck, without moving your head, only moving your eyes, look side to side. And it's very subtle, but you should be able to feel those muscles in the back of your head move just a little bit. Are you noticing that? It's okay if you don't, but most people kind of will feel those muscles. So that's just some awareness. So I think it's interesting that the muscles back here, which are really postural muscles, also are affected by your eyes. So the first thing I want to recommend is if you're starting to feel that tension headache, stop looking at your screen. Don't look at your phone. Don't look at your computer. Just look out the window, look at the plant. If you happen to have like literally anything, just take a vision break just for a minute, just 1 minute. Look at something else, okay? Close your eyes, feel your breath, whatever it is, but just rest your eyes. That will help rest this area too. To stretch your suboccipitals, you're going to look over your left shoulder. You're going to look down towards your left hip, and then you're going to take your left hand, place it on the back of your head, and pull down for a deeper stretch on that right side. That looks good, everyone. Good job. And then whenever you're ready, slowly bring your head up and then looking over the right shoulder and then down and doing the same thing with the right hand, pulling down so you have a stretch on the left side. Sometimes people want to put both hands on the top of their head for a deeper stretch. It kind of just depends on what feels best for your body. That looks really good. Yeah, so you're turning your head and then looking down. You're not just going to the side. That's really good. Good job. Did you feel that stretch? So Jackie, try that again. So look over, like, no, no, yeah, no, don't. You're looking over and looking down at the same time. So you want it to be linear. So first, look over your right shoulder and then look down and then pull down. And it's that way you're doing it a little, does it feel different to you when you do it that way? Yeah, that way. Yeah. So doing it in like two separate motions. Very good. Good job. Okay, that's another great one. The next one is stretching your scalenes. Next time you go in for a massage, be sure to ask for your scalenes. You will hate me for this, but you got to take your medicine. And the reason I say it's important to stretch your scalenes, let me back up. It's important to stretch your scalenes because we breathe like 20, 25,000 times a day. Truly, 20 or 25,000 times a day. And if we're not breathing with our diaphragm and expanding our chest, I mean, think about how you were breathing at the beginning of this call. Hopefully it was really healthy and deep and even, but maybe you could feel that your chest your breath was maybe a little bit high and you're maybe breathing up here. So if you're not fully breathing with your diaphragm, what's probably happening is you're using your scalene muscles to lift your rib cage up. And just like someone who has maybe say carpal tunnel, they didn't get carpal tunnel by slipping and falling on an icy sidewalk. They got carpal tunnel from it's called a repetitive stress injury. They had bad posture. So if we're breathing 20 or 25,000 times a day and we're not doing it properly, we're creating these repetitive stress injuries on these tiny little muscles which are not meant to be lifting your rib cage up 20 or 25,000 times a day. Now your scalene muscles are these like guitar string type muscles that come out of the side of your cervical spine and attach to your clavicle, your collarbone, and your first and second ribs. Okay. Through your scalenes is So we have your scalenes, your scalenes coming out this way. Boop. And then through your scalenes is the brachial plexus. That's the nerve bundle that comes from your neck down your arm. So if you have been just whatever, your arm is just feeling just kind of heavy and dumb one day, it just kind of achy and you can't quite figure it out, or your fingers are going a little bit numb and like, I don't know where this is coming from. It could be from your scalene muscles pinching your brachial plexus, and the tension might not be in your arm, it might be higher up here, right? So next time you go for a massage, ask your scalenes. You will not be happy about it, but it's really important to get that area worked, right? But to stretch your scalenes, you are going to, so again, another pin and stretch. So where your clavicle meets your sternum, okay? You're going to pull down, just kind of lateral to the sternum. Pull down on so hold on one second, Jackie. Keep your head straight. There you go. Okay. So pull down on that area and then bring your head over and back like a 45-degree angle. And you should feel a stretch through the front there. Yeah. There you go. And then bring it back and then you do the other side. So pulling down and then head back and over. So pull down first. Yeah. So pull down first. There you go. There you go, Nisa. Pull down first and then go over. And then bring it back. And then one more you can do just to stretch the front of your neck. Now your scalenes aren't here, but there's a lot of fascia here. And if this fascia is tight, it's just going to pull in everything else. You can just pull down on your sternum and then lift your head up and back. Yeah, good. Good job. Do you feel that stretching in the front of your neck? That's going to be so good. Good, good, good. And then in addition to that, stretching your upper traps, because it's a big, meaty muscle. And again, if your traps are tight, it's going to be pulling on everything else. This one's maybe a little bit hard to do in your chair. We can try it, but again, it's a pin and stretch. So your traps are up here and your neck gets sore and tight and you're just kind of doing back and forth with this, right? But if this is tight and you pull your head to the side, it's just going to come with you. So anytime you can do a pin and stretch, that's always going to deepen that area, that stretch. So you could maybe sit on your hand, you can maybe push the floor away, you could pull on the seat of your chair, but let's do it on the right side. So whatever you need to do to just kind of like stabilize your right shoulder, maybe you're pushing the floor away or pulling on your chair, what have you, and then bring your head over, and then at the top, bringing your hand and pulling over a little more deeply. There you go. That should create a deeper stretch for your traps, which then will benefit your scalenes and your suboccipitals and all that stuff. And then letting your hand go first, then your head back to the center. And then the other side, so you're pinning the left side down somehow. You're sitting on your hand, you're pushing the floor away, you're pulling on your chair. Then bring your head over. And then taking your right hand at the top of your head. Very good. Good job. Excellent. Okay, so we've done jaw, neck, shoulders. Now we're going to do the chest. I'm sure a lot of you on this call probably have some upper back tension. It's very common to get that because what are we doing all day? We're driving, we're typing, we're carrying children, we're carrying groceries, we're reaching for things. Everything's here in the front. So these muscles are getting a lot of work. These muscles are going to be overworked and stronger than your rhomboid muscles in the top of your back, right? And I like to explain to our clients, people will come in, they'll call and they'll be like, I just want a half an hour and I just want you to do my neck and shoulders. And it's like, if that is all that you want, we can do that. But let me explain to you why an hour is going to be more beneficial. Because we can massage where it's hurting, but it's more beneficial that we can massage not only where it's hurting, but where it's coming from. And if you think about, like, if you're playing tug of war with like a kindergartner, right? You're bigger and stronger than the kindergartner. And when you're pulling, who's gonna collapse first? The smaller, weaker kindergartner, right? Same goes for your muscles. So if your pecs are really tight and really strong, these smaller, weaker muscles in the back are going to be trying to pull back and they're going to spasm, and that's why you're going to feel it back here. Okay? So strengthening your upper back and stretching the front of your back is good. And it is a little bit hard to do in your chair, but if you're able to reach behind you on your chair as best you can, just pull back and then just kind of open up your chest as best you can. If that doesn't work for you, you can stand up. You can grab your hands behind you, right? And reach forward that way. When you maybe go to get a cup of coffee or wash your hands, you could stand in a doorway and you can reach forward. even just doing this, sitting at my chair, holding my hands back is helpful. But anything you can do to open up the front of your chest is going to help your upper back. Okay. What else we got? Okay. Any questions so far? We're still working our way. We're about halfway done. We're going to do a couple forearm things, some migraine things, and some hip things. Any questions so far before I keep going? Doing good? Okay. Okay. Now, if you happen to have your washcloth, you can get it out. Being that my background is as a massage therapist, I'm well trained on the art of caring for your forearms. And I would often, when I would go in after working with a client, washing my hands, because I'm often using my elbows, washing up past my elbow. When I'm drying my hands, I would often do a bit of a myofascial release with the washcloth, right? So it's great if you have terry cloth because it's going to be grippier. And what we're doing here is we're going to be pulling on the fascia surrounding the muscles in your arm. I mean, we're typing, we're texting, we're driving. These arms are getting a lot of work. And the fascia is basically the connective tissue that surrounds all of your muscles. So if your fascias are really tight, it's going to constrict those muscles and you're going to have less blood flow, less range of motion, and more tension. So if you can open up the fascia, that's going to help the muscles overall. So you're going to grab your washcloth, you're going to put it around your wrist, and you're basically going to be turning in opposite directions. So just from top to bottom as best you can. And there's really kind of no right or wrong way to this. Everyone's body is going to feel a little bit different. But as best you can, just kind of pulling on that. You can even kind of go up and down your arm with your washcloth. And you're trying to you kind of feel that pulling. And I know I just took my headband, whatever, my hair tie off. So I've got a little tie there. But do you see it's red kind of compared to this arm? Right, so we're bringing blood flow to that area. That's going to help that muscle, just bring nutrients to that muscle and just oxygenate it. That tearing up that fascia is going to help it relax a little bit more. And then either before or after that, you can also stretch your forearms. So you're going to start with your hand like this, other hand like this. You're going to grab it and you're going to go up and down. So you're going to go like that. There you go. Yeah. Yeah, you're just going to go in a forward motion. I only went sideways, Nisa, so you can kind of see the motion that I'm doing. So I'm starting off bended, going up and diving forward. Yeah? And that should be a really great stretch in your wrists. Oh my God, it feels so good. There, good, good, good. Okay. And by doing it this way and not just this way, by going up and down, I just feel like you get a deeper stretch. You're kind of stretching more of the muscles in your arms, coming in like different directions. Yeah? Okay. Migraine massage. So one of the things that we offer at Soma Massage Therapy, one of the many, many modalities that we offer at Soma Massage Therapy is reflexology. And the theory behind reflexology is that every area of the body and every system in the body has a corresponding point on the feet, the hands, and in the ears. You can add a reflexology add-on to your session for things like an extra $10 and just tack it on at the end or at the beginning or in the middle. You can just have a standalone reflexology session. If you just want to book a 30 or 45-minute session, we can do that too. And it's really great when you have like an area of your body that needs the work but is just too sensitive to be touched, right? Like if you've got just a really hyperactive sciatic nerve, but you know that you need your hips worked, and we can't spend all the time there, we can kind of go around like through the back door and do some reflexology. Or if you are maybe dealing with constipation, right? Or migraines, or maybe you're pregnant and you can't lay face down, right? And we want to be able to get to different areas of your body. So reflexology would be it's really beneficial for anyone, but those are just a few examples of when you might request it at Soma. So if you're dealing with migraines or headaches, a really great point that you can massage is here on your hand called the thenar eminence. Now, this is a really powerful release point. And so it's contraindicated for people who are less than like 37, 38 weeks of pregnancy. So if you're watching this later at home and that's you, maybe just avoid this point. But basically what you're going to be doing is this area here, kind of that meaty part between your thumb and your first finger. You're going to be massaging it with your thumb, and then instead of kind of using your finger here, because that can get kind of weak and tired, make more like of a knuckle and put it there. And you're just kind of massaging it. You're just squeezing it. and I was taught in massage school to really kind of like massage with intention. I know it sounds silly, but you're like pushing with your belly. If that makes sense, it makes sense to me as a massage therapist. But you know what I mean? You're not just like just squeezing on it. You're really kind of with intention addressing this area. And you can do it on both sides, and this is something you can do anywhere, anytime. No one even needs to know what you're doing. You're just giving yourself a massage. And this can be really helpful if you feel that migraine creeping up, you feel a headache coming on, maybe you're constipated, maybe you just need an emotional release because it's a really powerful release point. This would be a really good one for you to massage as often as you need to. That's a good one. And then lastly, if you happen to have a tennis ball, bonus points if it's a Soma ball. But this is really great. There's lots of different ways you can use. I wonder if oh yeah, we happen to have these really cool like self massage. You can't read it, but just as an example, we have these like self-care like how to use a tennis ball for self massage cards that we often give away with these. So lots of different ways you can use this, but for the purpose of today, we're going to be working on our hips. I'm sitting on a squishy chair, so it's not going to be as powerful and effective for me if you happen to have like a firmer dining room chair or a bench. If you are on a long haul flight because those airline seats are not comfortable, but if a firmer surface is going to be better for you. And what you're going to do is you're going to put this tennis ball under your hips where that achy spot is, and you are going to lean into it and go to town. And what you're trying to do is kind of like mimic your massage therapist's elbow in your piriformis. And you're just going to go to town and you're going to roll around on that thing. It feels so good. I will always pack a tennis ball when I'm flying across the ocean. I used to live in Europe and I'll go back and visit my friends, right? Like on a long haul flight, I will pack a tennis ball and just sit on it and just kind of work out those hips. That's really great. You can put it on the floor and roll your foot over the top of it for a little massage. A lacrosse ball works just as well, sometimes even better because it's firmer. You can also take this, and put it between your shoulder and the wall and like roll up and down the wall and kind of get that spot between your shoulder blades. You could put two of them together in a gym sock and lay on it to massage those suboccipital points. Lots of things you can do just with a simple, humble Soma branded tennis ball. So that's that's another thing. And then the last thing I want to mention too, I'll bring back up my slides here, is there's lots of tools that you can use to keep on hand in your desk drawer. See, there we go. So I have, for example, here I have a Theracane. It's got these really cool like knobs on the end, and you can massage yourself very easily using a Theracane without kind of contorting your body in different positions. It has different knobs where you can just do lots of self-massage things. You can have like a massage gun. These would be really great to keep in your desk drawer, or if you're flying, lots of different attachments that you can use. Different essential oils. What do I have in my drawer? I'm sure I have something. I've got some rosemary, some gentle baby. You just, put this a couple drops on your wrist, put it in a diffuser. They don't have to be those flavors, but whatever works for you. A fascia blaster to tear up your fascia. It can be smaller than this. There's various fascia blasters of like different sizes. You can like even pocket-sized ones. You can just kind of go to town on your IT band. All sorts of different things that you can use to keep in your desk drawer. If you commute a lot, you can put it in your glove compartment. And if you're stuck in traffic, why not use that time to care for yourself instead of getting stressed out? So there we go. So before we wrap it up, we're going to take some time here to check in. Okay, so once again, closing your eyes, finding that comfortable seated position. We just spent some time relaxing the jaw, the neck, the shoulders, the back, the pecs, the arms, the hips. So closing your eyes, relaxing your jaw and tongue once again, and scanning top to bottom. How does your breath feel? Maybe it's a little more smooth or even or deeper. Maybe it hasn't changed, and that's okay. Noticing how you feel different, noticing if that area of tension in your right shoulder is resolved, or maybe your low back feels better, even though we didn't even work on the low back today. Again, taking a moment, bringing that awareness now that your body's a little more relaxed, gently clenching your teeth, feeling how it tightens everything up, and then relaxing again and feeling that softness throughout your body. Before you open your eyes, thinking about one simple thing that you can do to care for yourself for the next week. Maybe it's as simple as drinking an extra glass of water or going to bed 10 minutes earlier. Maybe it's remembering to relax your jaw before you go to bed. Whatever it is, think of that thing. Whenever you're ready, I invite you to open your eyes. I'm going to leave my contact info on here for just a minute. And I am curious if anyone would like to share. Do you feel different compared to the start? And if so, how?
I'll share. Um,
Great.
when we started, my breath was very up high. I could
Mm-hmm.
not get it down. And just now, it just easily flowed down. And
Yeah.
I tweaked my trap working out earlier this week. So it's very tight and I've been moving around. And now it's much more relaxed. So
Oh,
thank
I'm happy to
you.
hear that. That's great. Good. Thank you. Lisa or Jackie, it's not required. Would you like to share?
My breath, like Shannon, was so much easier and so much deeper. Like I was struggling
Uh-huh.
like to get my breath all the way down to my diaphragm. And then at the very end, when you had us breathe again, I was like, oh, there it is. Like
Love
I don't know
that.
if you noticed, but I was yawning a lot in the beginning because I couldn't like get the full breath. And
Yeah.
this, what did you call this again?
Your scalings.
Oh
Yeah.
yeah.
Right? Are
Yeah.
they jacked? I know.
Oh yeah.
I
Thank
know.
you.
Not just you. Not just you. It's very common. Good. Yeah, that's a really useful one. And just remember that the next time your arm is like, oh, what's up with my arm today? It's your neck. So yeah, it's your neck. I'm curious, with the jaw tensing at the end and then relaxing once more, was it more pronounced at the end? Did you notice? I'm just curious. Did you, because when I've done these webinars before and seminars, at the beginning, people were like, nope, I feel exactly the same. And I'm like, I am sad that that is your answer because there's no judgment, but I'm like, you are jacked up. But then at the end, they noticed that they did feel that difference. And I'm just kind of curious, did any of you feel a more pronounced difference at the end when you clenched your jaw and then when you relaxed it, or was it about the same?
I
Again, there's
felt
no right or wrong.
Mine mine felt deeper. Like I felt like my breaths into my diaphragm was good. I felt in both sessions of breathing, but I felt a little more restricted past my diaphragm, like down into my
Yeah. Yeah.
hips,
Uh-huh.
and my sits bones.
Yeah.
And that felt more open. That
Good.
you know, when you said like take the ball down to your foot, I took the ball down to my foot. I mean, I was like fitting all of it in when you were like and move more, and so I did, and I definitely felt more opened in my lower chakras than what I felt pretty, and I've been sitting a lot this day so far, so
Yeah.
I think I just need to get up soon.
Yeah, you do. You do. No, I'm glad you felt the difference. I'm going to stop the recording now. We're all welcome to hang out a little bit longer, but for those of you who watched online, watch the rerun, thank you so much for joining us. Again, mysomamassage.com. You can find us online. I'm happy to bring this seminar to you in person, or we could do something online virtually like we did here. And again, a reminder of our franchise opportunities. Go to mysomamassage.com to learn more about that. Thank you for joining me today.